Welcome to Crohn's Talk 15. My name's Marcus. Talked to my doctor this week, a couple days ago, about surgery. Surgery is something that you want to avoid if possible, and I've been able to for 29 years. I've been able to just use medication and not have to do surgery. The problem with surgery is once they go in, they may think they're only taking a little bit out, but they can get in and find more and end up taking more than originally planned, which could greatly affect your quality of life. Traditionally, there's always been a really high chance that if you've had one surgery, you're going to have more. However, with current treatment, that percentage has dropped significantly. My doctor this week said it was around 4 to 5%, as opposed to the 20s, 20 to 30, like it used to be. So that's actually pretty good odds. He said especially that I was able to avoid having surgery for the first 30 years, that I have a good chance, if I have it, that I'll be able to avoid a second surgery for a long time. So that's all good news. He's a little hesitant because I'm not in dire need of it yet. But my argument is I don't want it to be an emergency surgery. My stricture is close to 1 to 2 millimeters. The majority of it is scar tissue, so that means it's never going away. He tends to think that some of it is also inflammation, which should go down with the infusions. But even if that's the case, it's still going to be a pretty small opening. And really, the way I look at it is that's one grain from a whole grain bread, one accidentally swallowed watermelon seed, one kernel of corn away from a disaster. He also said the ballooning behind the stricture, that I have it, there is ballooning, but it's not horrible, and generally you look for it to be worse if you're going to do surgery. So the problem with that is the only way to tell if that ballooning is getting worse or the stricture is getting smaller is to continue to have MREs, and I can't just have one of those every 3 months. It's impractical, and my insurance is not going to pay for it. So how do you tell? That's the problem, is you don't know if it's gotten worse unless you just happen to have a test at the right moment. Otherwise, the way you know is that you're suddenly in severe pain and nauseous and you're on your way to the emergency room. And that's what I'm trying to avoid. So I talked to him, I said, yeah, I understand the medical kind of hesitance to go for it now, but if it's inevitable, then why not do it now in a controlled situation rather than wait for a potential emergency? He agreed. He said it's not inevitable in the next 3-4 months, but it could be in the next year or so. And to me, it's like, if it's inevitable, it's inevitable. It's not like 10 years ago they said I may or may not ever have to have it. Now it's basically you will have it. It's just a matter of whether it's a year from now or 6 months from now. He said the other option is they go in and put basically a balloon stent inside the stricture to open it up, but the problem with that is it only lasts for a little while, so I'd essentially have to have like 4 colonoscopies a year to reinstall these stents, and that's just not feasible. You can't just continue to do that. So, and the other thing you have to think about, and I talked to him about this, I said there's practical considerations. What's work like? And right now, luckily, I would be able to take a couple weeks off of work, and it wouldn't be too bad. Whereas 6 months from now, I should be a lot busier, and it'll be harder. And the second is insurance, and I've reached my max casualty for the year. So if we can do the insurance between now and the end of the year, it doesn't cost me anything, and that's huge. I'm not paying for the medical, the hospital stay every night, the doctor, the anesthesiologist, all the different things. Yeah, I have good insurance, but all those little charges are going to add up, and it'll be really expensive. Whereas if I do it now, it's free. So he agreed. He's sending me to see the surgeon for a consult, and I feel weird like pushing for surgery, because why would you push to have yourself cut open? But it really, like, everything is kind of lining up to where now is the best time to do it. You can see that I've got a bandage on. I just had my third infusion today, so I'm now on the 8-week schedule unless I start getting symptoms earlier and we have to adjust it. But we'll see what happens. We'll see what the surgeon says. He's reviewing my records now and should give me a call so we can talk about it. See if he's someone who is kind of pro, let's get this done, or hesitant. So we'll see what happens. I'll let you know. Hopefully when they go in, it won't be worse than they think, and they won't have to take out more than they think. Mine is really close to the ileal valve, so I hope that remains intact. So we'll see what happens. If you have any stories or similar experiences you'd like to share, leave them below in the comments. Let me know if there's other things that you want me to talk about, and I will see you next time on Crohn's Talk.